Good afternoon. We are Rosana and Marta, and we are currently studying a medicinal chemistry PhD on the Faculty of Pharmacy. Our research goal is to fight the flu, so we try to synthesize new compounds which target the influenza virus, which is responsible for this illness. When we explain that, it may seem that we are producing pills or maybe new drugs every day. However, where are we in the therapeutic development process? We are there, on the drug discovery step. So we have 0.1 per mil possibility to synthesize a new meth. This may seem discouraging. However, winning the lottery is even harder, and there's people playing, so it's not that bad. Ours, it's a multidisciplinary area. At first, we have to choose an illness and look for a suitable target. This is a virus, a bacterium, or a protein. After this, it's time to rationally design a compound which matches that target. We do this by reading bibliography and collaborating with crystallographers, bioinformatics, or chemoinformatics, which give us a model. After this, it's time to go to the lab and synthesize some compounds which will be evaluated by pharmacologists. As we said before, our target is to fight the influenza A virus, the responsible for the well-known flu. This disease, even looking as a mild one, has been put into the spotlight of the scientific community due to its wide negative impact on the worldwide economy. This is by causing absenteeism from work, poultry damage, or by an indirect way, collapsing the sanitary system or giving fatal complications to people. Moreover, we have to bear in mind that everyone is a possible victim for this virus, so its scope is enormous. In addition, its mutability rate is so high that new viruses appear easily. Once per year, undergoing small changes on its structure, new mutants appear, giving the seasonal flu outbreaks. However, 2 or more viruses can also recombine to give a brand new strain. This happens 3 to 5 times each century, and it's the pandemic's origin. And this is what we should be afraid of. Why? Because if an easily transmissible virus like H1N1 gets to recombine with a very virulent one like H5N1, a very dangerous new strain, which spreading is very easy, will appear. If we take a rapid look back to history, we will see that these pandemics have killed millions of people among history. So now that you know why are we focused on looking for anti-influenza A agents, it's time to know what options do we have nowadays in the market. Well, the virus has 8 proteins, from which 5 are suitable targets. Among these 5, only 2 of them have marketed drugs. This is neuraminidase and M2 channel. Nevertheless, these drugs are rather old, and almost all viruses are resistant to them. So that's why we believe that there is a real need of synthesizing new compounds who can fight this virus.
The target of our compounds is the M2 channel, a well-studied protein that, together with hemagglutinin, permits the viral infection by the fusion of the viral and cellular membranes. Our strategy is to block this channel by introducing bulky compounds like in this picture is doing amantadine in yellow, as a cork does in a bottle. The virus is able to escape from these M2 channel blockers, changing the diameter of the channel. One of the most relevant mutants in clinics is V27A, wider than the wild type, so amantadine is too small to block it. Our purpose is to design and synthesize bulkier compounds to try to inhibit not only the wild type, but also this white V27A channel. Recent achievements of our group are presented in this table. These bulky compounds 8 and 9, with these bulky compounds 8 and 9, we achieve the blocking of both channels, and wild type and V27A channel. With a percentage of inhibition around 93%, 1 order of magnitude greater than amantadine, that is the reference compound. Surprisingly, while exploring new scaffolds, we found all these compounds that have a nice activity against the virus, but with no significant inhibition of the M2 channel. Pharmacological test gave us values under 15% of inhibition. These results suggested another mechanism of action. All these compounds selectively target the viruses with hemagglutinin type 1, while they don't show any activity against viruses with hemagglutinin type 3. Our virologist collaborator, Professor Liv Nessens from Riga Institute, studied this mechanism of action, selecting new mutants under the pressure of our compounds, and 3 new hemagglutinin mutants were detected. This way, we discovered a new and promising mechanism of action to fight the flu, the inhibition of hemagglutinin, unknown to date. Here, we can see the importance of integrating different disciplines to move forward towards our objectives. This finding led us to continue investigating in targeting not only the M2 channel, but also the hemagglutinin, and the horizon that it opens to new therapies. Finally, we want to introduce you our research group and to thank all the support received from them. And if you want to know more about our research, we invite you to visit our webpage. Thank all the organizing committee for giving us this great opportunity, and all of you for your kind attention.